One of my cheekbones is higher than the other, and it is noticeable. Is there any procedure that can fix this? My one cheekbone is higher than the other one, and it is quite noticeable. On the side of the lower cheekbone, my eye seems a bit more droopy than the other. Whenever I lift the top of my cheekbone with my finger, my face looks a lot lifted and my cheekbones are symmetrical. Is there any procedure I can do to fix this and give me a more lifted look?
Thank you for your question. You submitted a question without a photo, but you describe in your question that one cheek is droopier than the other, and that when you do a mirror lift, you find that that cheek is more symmetric with the other. So you're asking about a procedure that would best help you. Well, in the absence of a photo, I think I can at least conjecture as to what your current state of facial aging probably reflects based on that description. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and solutions for facial aging and asymmetry is pretty much what we do every day in our practice. So, in the description of your question, I think that we can conclude if both cheeks aren't significantly drooping, but your perception is one cheek is drooping a little bit more than the other, I think it's reasonable to conclude that in terms of facial aging, you are dealing more with the volume and anatomic change than you are dealing with sagging. Now, although there may be some degree of sagging, but just to understand that facial aging is both volume loss, bone, muscle, fat, soft tissue, significantly in bone, which is underappreciated, or as well as sagging. So when we look at a patient, we look at what is contributing to what is their main area of concern. So with the understanding that you're looking to create symmetry with the other side, and that when you do a little bit of a lift, you are able to improve that symmetry, my thinking is that what you're dealing with is probably a subtle but definitive asymmetry in the relative projection of the cheekbones, which is anatomic and normal, and it's pretty much applies to everyone. But you're also dealing with a difference in volume. And so when you do that vertical lifting, you're actually shifting the volume upward. Well, when it comes to volume loss, I think that we live in a very fortunate time. We have a technique that we use in our practice called structural volumizing. And what structural volumizing entails is the placement of a long-lasting filler, such as a hyaluronic acid from the Juvederm Ultra Plus or Juvederm Voluma categories, which by their chemical design is designed for lasting longer. And when I say longer, I'm talking about in the 1 to 2 year range. When we do structural volumizing, we're placing this material at the bone level. So it's really addressing the most important aspect of facial aging, which is bone loss. And when it's placed at this level, the appearance actually gives the face more structure, hence the name. I think that it is very important to differentiate this technique from what is the typical approach to cheek enhancement, which is to place the filler just under the skin to try to essentially re-inflate some of the deflated skin. But rather, by placing this material at the bone level, the skin does reinflate, but at the same time it looks more angular, it looks more youthful. There's something called the golden ratio, which is a very important aspect to beauty in faces and in nature all around us. And when you create volume in the right place at a structural level, you restore this golden ratio. It's a very, very nice and elegant enhancement that looks very, very natural. I think that when you when you entertain the idea of possibly lifting, yes, a procedure such as a mid-facelift may have some value, but I would say that my experience and my perception of mid-face lifting or any type of procedure that tries to shift volume from the lower part to the upper part of the face, very often it falls short in the true volume correction, and by throwing off these natural proportions, it actually makes someone effectively look more plastic. And that's that look where you know that somebody had something done, but they don't quite know exactly what. You assume it's some type of a facelifting procedure. So with structural volumizing, we're actually restoring a lot of the volume rather than trying to lift and displace the existing volume to a place where it might contribute, but will not. But with the unfortunate downside, I think it's not going to be as effective. So structural volumizing in the mid-face, I think, will probably be worth pursuing in terms of your knowledge and appreciation. Again, without a photo or a physical exam, I'm trying to use basically the limits of the descriptions to give you a suggestion as to what I would do for patients like yourself who come to our practice. So I hope that was helpful. I wish you the best of luck, and thank you for your question.